Hi, I'm Dr. Diviya, a gynecologist. Today we'll be talking about bleeding in pregnancy that happens beyond the fifth month of pregnancy. Medically, this is called as antepartum hemorrhage, and there are two major causes for this. One is placentaprevia, and the other is abruptio placenta. For better understanding, we are going to see them as two different things. So, coming into placentaprevia, it is a condition wherein the placenta lies in the lower uterine segment. Normally, the placenta is seen in the upper uterine segment. So, during your scans, we'll be able to look at the placenta and its site. So, if it happens to be occupying the lower uterine segment, we call it placentaprevia. So, why this happens, the reason is not very clear. But the good news is, most of the time, the placentas which are seen in the lower uterine segment in the earlier half of the pregnancy spontaneously move upward to the upper part of the uterus. Very few of them do not migrate, and those few are the ones which cause trouble with bleeding kind of problems. So, when bleeding happens, what you're expected to do is to reach your healthcare provider immediately. So, your doctor will do her initial assessment and they will make a plan of treatment. So, this plan is dependent on the severity of the bleeding. If the bleeding is very severe, or if there is an obvious threat to the life of the fetus or the mother, your doctor will be planning you for an immediate cesarean section. If the bleeding is a small bout of bleeding which stops after the initial management, and if the baby's heartbeat is going all fine, you would be advised what is called as a conservative management. So during this time, you will be advised rest, and if you happen to be in your preterm phase, you will be advised steroid shots to enhance the lung maturity of the baby. So, why is your doctor advising cesarean and not trying for vaginal birth? It's because the placenta will be blocking the natural passage of birth. So, with the placenta, which is a very vascular structure occupying the lower uterine segment, trial of labor can be detrimental. It can lead to a lot of complications, and that is the reason we do not try for vaginal delivery in a proven case of placentaprevia. So, as I told you, the earlier part of pregnancy, that is the earlier week, like say the timing of your anomaly scan, if you find a low lying placenta, please do not panic. As I told you, most of them will migrate. So, the placentas which do not migrate up to say around 30 weeks, we take cautions only those we are worried about, not in the earlier half of the pregnancy. So that's it about placentaprevia. Going on to know what is about abruptio placenta. This is a totally different condition wherein the placenta is situated in the upper uterine segment, which is its normal site. So what happens is this normally situated placenta begins to separate itself from its uterine attachment. Normally, the placenta separates only after the delivery of the baby. So, when the baby is within the womb, when the placenta separates, it can cause major complications to the fetus and to the mother. So, obviously, you need immediate medical attention. So, after your initial assessment by your doctor, depending upon the grade of abruption, they will make the plan of management. So, if it happens to be a severe grade of abruption, or if there is an obvious threat to life of the mother or the fetus, you will be taken up for an immediate cesarean section. So, if it's a milder form of abruption wherein the bleeding stops, and if the baby's heartbeat is going fine and mother's condition is stable, labor can be induced, and the process of labor can be augmented with medicines, and we can plan for vaginal delivery if there is a possibility of delivery happening within few hours. However, immediate delivery is needed once the diagnosis of abruptio placenta is made. So, both these conditions present in the same way. Both are going to have bleeding, and for a layperson, it may be a confusion as to which is what. But for a trained medical person who has good clinical acumen and basic knowledge about both these conditions, it's a cakewalk kind of a diagnosis. just at the sight of the patient and after the initial examination and history, your doctor will be able to diagnose immediately. So, this immediate diagnosis and prompt management is the only thing that can save the mother and the fetus in this kind of a condition. So, these are considered as medical obstetric emergencies and it needs immediate medical attention. So, happy pregnancy to all of you. Take care. If you like the video, please do follow. And if there is any queries regarding the video, please free to ask in the comment section. And more support and love from all of you is expected. Thank you.